Hey everybody! So I want to talk about something really specific today, and that is one thing to definitely include on your exam when really every exam, and we teach you in the academy to include this on every exam. Definitely when you're talking about a presentation of hyperactivity, impulsivity, um, ADD, ADHD, diagnosed or undiagnosed, this is something you want to look at. And this is a common presentation. Now, the whole point of this is not to get you doing a bunch of things that are not chiropractic. The whole point of this is just like you look at thermography, or you look at posture, or you look at heart rate variability. We need to have indicators, clinical windows, clinical indicators into change in the system, right? You look at leg length, you do postural checks, you palpate, you use your technique. This is something that is really important that we need to define more on our chiropractic exams, how we are actually impacting the individual. We are actually impacting the brain, the tools that a person, a child, an adult is using to process their world. Well, we need to get a little more clear on our exams. Doesn't mean you have to do an hour exam. It doesn't mean you have to do a bunch of functional neurology exercises. Some of you might want to include that in addition to chiropractic, but most of you won't, and that's fine. That's good. We just want to encourage you. I want to encourage you to know a little bit more, be able to have a more complete understanding, and not just say like, hey, I know I'm changing the brain when I correct subluxation. That's right, but let's know a little bit more. Let's look at a few different things. Let's include more in our exam, be more inclusive in our exam to understand how we're changing the brain, how we're changing the tools, how that is changing the tools that a person is using to process their world. So one of those things is in a presentation of an individual, adult or child, with impulsive, hyperactive, inattentive type behavior, maybe a diagnosis, ADD, ADHD. One of the things that we see that's very common is that they have a more central vision focused visual system. So when we look at their visual motor system, their eye movement coordination and accuracy, we see that they have more of kind of this collapsed, typically this collapsed peripheral field. Not always, and not at all times, but we do see this. And so what you'll see is you'll see more central vision engagement, and you'll see a decreased visual field. Now, you may want to do, get right eye software, or do, visual field measuring, which I think is cool. I think it's great. I don't teach you to do that. I teach you how to take some of these things and implement them into your practice. So you don't do all these other things. You stay chiropractic, but you know more. And you can measure change. And then you can communicate better and answer the tougher questions, and really see what we're doing to help these kids. And use that to guide you to know when they might need something in addition to chiropractic. Okay, so what I want you to do is I want you to do a basic, convergence and fixation. So 8 to 12 inches in front of the nose, center. Now there's some variations in complexity of whether you do this seated or standing and all these things. We're not going to get into that today. We teach that a little more in some of the seminars, but you want to hold an object. It could be a pen tip. It's better to be smaller than this even, and not a color. It's better if it's not a color, like if it's just like a neutral color. If it's a kid, you might put like a little topper on it. Or one of the things we like to do is use like a popsicle stick and put a sticker. And if it's like a really little one, like 5 years old, which is really when we want to see a lot of efficiency here, is like that 4 to 5 to 6 year old, we should be able to see some appropriate movement in the visual motor system and accuracy in the visual motor system. So you might have them pick a sticker, make it fun. Just take a popsicle stick out, or a tongue depressor, put a sticker on it. Okay, so you want to hold it 8 to 12 inches outside of the out from the nose, and you want to see, can they converge their eyes, bring their eyes in together and have fixation, stable fixation. They're not having to turn their head, their cheeks aren't getting pink, they're not getting stressed or creating postural distortion. However, if they are, and again, we should be seeing that this is not a difficult task for a 5-year-old, right? Even like 3, we should be able to do this okay. 3 to 5, but 5 for sure. We should be able to do this okay for a good 20 seconds, no problem. Really more than that, but that's what I want to look at without seeing big postural changes or things like that, or big autonomic response, pink cheeks, eyes tearing up, butting it with their head, laughing hysterically, sad, crying, anger, avoidance. These are like, ooh, that's a window into the brain that is invoking a autonomic response, sympathetic response. This is a challenging task. It's not just if they can do it, it's how they're doing it. So we're looking there. And then what I want to do, we're not going to do just a basic convergence divergence, although that's important and we teach that. For this particular activity, we want to look at and what's happening out here. Now, we want to just do some basic H patterns. You may have to put a little like a little stuffed animal or a bean bag. That's the best thing to do on top of their head if they can't keep their head still, which also tells you if they can't keep their head still and they're 5 or older to do this task, then they're needing to drop down in what we call one of the hierarchies to engage gross motor to do this visual motor task. We want to see, are the eyes able to move in a smooth and accurate presentation in this basic H pattern. What you will see often in the impulsive ADHD, ADD presentation is particularly in the upper quadrants, but sometimes lower and upper quadrants out here. We'll get some stuttering of the eyes. We'll get some, I can't quite go there. I go back to midline. I get lost. Or, they just have difficulty and they try to avoid, and just on a basic, like I do this sweep just a couple times and they're trying to avoid this. They want to be more in this collapse, especially in that impulsive type presentation. They want to be in this collapse more in our central visual field as opposed to using our central and peripheral together, and we have a decreased visual field. So that's a really common presentation, and the reason I want you to include this in your exam is I want you to just get used to looking at the eyes as just a piece. You're looking at posture, you're doing your palpation, you're looking at your x-ray, you're looking at range of motion, you're doing thermography, HRV, whatever you do there. Of course, we teach you to do some of those things. We look at pupils, and just let me get a quick little visual pursuit and see. A lot of times when we cross midline, we'll also see some abnormal movements, and we want to just mark it down. What I want you to do right now is I want you to just watch and wonder. I want you to observe this, and in that presentation on your re-exam, I want you to observe this again and see if we're seeing changes. If we're seeing chiropractic changes, clinical indicators that subluxation is improving, efficiency in input processing output is improving. However, we're not seeing changes here, especially in the 5 or older. This is when we know, okay, great. We need to keep doing what we're doing as far as input, processing, output, chiropractic. However, we're not seeing movement here, and we need to add something in. Perhaps we need to add brain blossom. Perhaps we need to add neurooptometry. Perhaps we need to add primitive reflexes, bottom up. We teach you to kind of test those so you know where to start. But we can't do any of that if we don't first look at it. And so we need to use this as a clinical window of measurement and observation so that we can track it, so that we can know when we need to, and if we need to, and what we need to add in. This allows us to stay in the chiropractic lane. However, to be the team leader, the quarterback, answer the tougher questions. For those of you that are out there that are like, but all I need is chiropractic. Listen, I agree that chiropractic has got to be the foundation, and a lot of times we don't have to do more. But a lot of you out there are like, yeah, but a lot of times we do, and if we're not getting the results, how do I know what other providers or what other exercises or nutrition or things to bring in, and how do I not lose them to that? We know they need to still be under chiropractic care. We know we need appropriate input, processing, output, and sometimes we need some other things as well. Brain blossom exercise, functional neurology exercises, primitive reflex integration, nutrition, neurooptometry. How do you know OT, speech therapy? How do you know what they need, when they need it, and if they need it, if we're not looking at some of these functional brain-based skills and then re-looking on re-exams? This is the beauty of this work. This is what allows us to feel free with staying in the chiropractic lane, being really, really good chiropractors, knowing a little bit more, knowing how to do a proper exam, knowing how to communicate that, knowing how to work with other providers, and be really valuable provider at that table for these kids in your community that desperately need you now. Okay, so start looking at that and let us know how that goes. You will definitely see that this is a common, this visual field out here in the periphery is a common area that you will see challenges, especially in the superior, well, in both quadrants, but particularly up here as well. Okay, everybody, do good work. Happy to have you in this group. Unfortunately, there is a massive amount of families who are struggling right now with behavioral learning and socialization challenges, and they're looking for solutions. And most people have no clue why. Most chiropractors have no clue, but why we should even be in this discussion. And in reality, a lot of professions, other disciplines, are looking at the nervous system. They just don't know that that's what we do. So we don't know that that's what we do, but when we learn, when we know more, it's pretty amazing. And the results are pretty amazing. All right, be well, do good work, help the families. See you soon.